If you're dealing with shoulder pain, this is gonna be an extremely important video for you to watch. What we're gonna go through is where we miss on shoulder pain, where we're having more problems with it, because everybody does internal and external rotation when somebody has shoulder pain. We're gonna dive deep into the anatomy and what you need to know exactly of how to fix it. Let's get into the video. We have to understand the anatomy of the shoulder so that we can fix it. We're looking for long-term fixes in here, and we want you to have that information at home. So thinking about the shoulder, this is the entire shoulder complex right here. So it sits right here on my shoulder blade, right? I have this shoulder blade right here. The only bony attachment for that is right here in the front of the shoulder. So our SC joint is the only bony attachment of the entire shoulder complex, and it just rotates like this. And everybody wants to work on internal and external rotation. That's our rotator cuff muscles right here. So they're pulling it around internally and externally, but the number one job of the rotator cuff is depression of this joint together, to sink it together so that it stays stable. That's the number one job. Now, doing a farmer's carrier exercise like that is really good, but internal and external rotation just gets overworked and overdone. The reason why is that our shoulder blade is like a wing that comes up. So when I raise my arm up overhead, you see my shoulder blade comes out to the side, and that creates the capsule for the entire shoulder joint. So when I'm raising my arm up overhead, this rolls and glides underneath it. And as it comes up, that keeps pressure off of our rotator cuff. In our rotator cuff, getting shoulder impingement where it causes irritation on the rotator cuff, that's the number one cause. Like 90% of our clients come in with that. Sometimes they have labral problems, but the majority of the time it's compression right here, and they're getting a fraying of the rotator cuff. They're getting a fraying of the rotator cuff in this glenohumeral joint. So the better we can be at moving this shoulder blade around, the better outcomes we're gonna get for our shoulder problem, because we decrease the amount of stress that is on this joint and on the rotator cuff. Now, diving into the anatomy right here, if I'm reaching for my seat belt, I'm reaching over and over my seat belt, and I don't move through my shoulder blade, my rib cage, then I'm just cranking on this glenohumeral joint right here. So what I want to do is reach back, and I'm moving through my chest right here, my chest, my rib cage, the bottom of my rib cage. I'm creating that space, and it keeps the balance in the glenohumeral joint right here. If we don't have this space right here in the rib cage and the thoracic spine, then when our shoulder blade digs down and in like this, when we're coming back, when it comes down and in, it's not going to have anywhere in to go into, so it goes up. So it's digging into our neck, and that's causing us neck problems, and it's going to cause some pinching here in this glenohumeral joint. Now, once we create that space, we create thoracic mobility right here. I can move like this consistently, not through my low back, not through my neck, but my rib cage. Just like an arrow shot me right here from my thoracic spine up through my chest. So I want to gain that mobility right there so that I have space when I'm coming back. But then we have to activate the right muscles to take that up. If we don't use it, we lose it. So we got to make sure that we have that space, and then we take it up on a consistent basis. And that's what we're going to be talking about in this video, is exactly how to do that. Go and hit the subscribe button and hit the bell icon for more videos like this, where we take a deep dive into the anatomy, because the next videos are going to be the action steps of exactly what you need to do, what exercises to do, what stretches, what's going to be most effective for you. You don't want to miss out on that. When we're looking at the shoulder blade, we have muscles that act on it. So a lot of our clients come in and say, my upper traps are tight, I hold my tension up here, this is where I hold my stress. And they're right. A lot of times we're sitting at computers for long periods of time, we start to drift closer to it, so we're in this hunched position. And when we do that, we're overactive in that upper trap muscle and this levator scapulae. Now, to counteract that, we need to be firing our lower trap. And so we set these rubber bands up so you can see. So the upper trap comes this way, all the same muscle. The upper trap, the middle trap comes across, and the lower trap comes down like this. And they all attach to the shoulder blade. So if my upper trap is overactive, then I'm gonna get really tight in this area, and it's gonna inhibit the function of the lower trap. So what we do is we increase that mobility, and then we wanna fire this lower trap, and that comes with scapular depression, driving my shoulder blades down and back. So depression and retraction, driving them down and driving them together is going to fire up those muscles, and we want to do that consistently. When we fire up the lower trap enough, then it's going to help us inhibit the upper trap, and then we're going to have more balance in that shoulder blade. Now we have a third muscle that's the holy grail of the shoulder complex that's really going to protect us. We don't start activating the serratus anterior muscle until 2 weeks of working on scapular retraction, on pulling the shoulder blades together. So we've got to work on pulling the shoulder blades together and down and holding it for extended periods of time, like sustained holds for 30 seconds consistently on a daily basis. When we do that, we're squeezing together right here, and we have this muscle right here. When I drive forward, it looks like ribs right here on my rib cage, but it fires out a little bit. So that muscle is actually attached underneath the shoulder blade, and it pulls the shoulder blade up against the rib cage, and that's what stabilizes it. So when you get your arm overhead, if we don't have that serratus muscle activated, which is a weird name, it's the serratus anterior. You can look it up. We can put a link in the description below, but we've got to get that muscle activated 2 weeks after we work on these muscles in the back. That shoulder blade pulls up against the rib cage, and it creates that balance so that we can get in a positive position and create that space for our glenohumeral joint where we're getting the shoulder impingement. If we do that consistently, you're going to be able to knock out shoulder pain and consistently keep it away. Another portion to look at, we always treat the shoulder and the neck together, because you can see how this upper trap is attached to our neck right here into the cervical spine. And we have something called active insufficiency. It's like a detailed term about what muscles are acting. So we have a fixed bone, and the muscle is attaching to that, and it's going to pull on the one that is mobile. So right here, if this is fixed, if the neck is fixed in one position, then the upper trap is going to pull my shoulder blade upward, right? Now, if my shoulder blade is dense, the muscle tissue is dense and stuck down, and this is glued against the rib cage, which we see fairly often, the shoulder blade just sits on the rib cage, so that the muscles end up being like glue. We've got fascia, we've got muscles underneath the shoulder blade, the rotator cuff muscles are underneath there. That starts getting glued down, and we're not able to glide that shoulder blade around. So in the next video, we'll give you some techniques on exactly how we do that, but really understanding the concept is important, because if this is glued down, then my movable segment is here in the neck. And so we had a client come in probably about 2 months ago, a very muscly guy, and he was having problems with his neck. He wasn't moving around his neck at all. Then we got 90% improvement in one session because we focused on the shoulder blade, the thoracic spine, and gaining mobility right here, because his neck was being pulled. It wasn't that his neck was the problem, it was that the shoulder blade being fixed and stuck together was the problem. So we've got to address both of them together. So when we're thinking about the shoulder, we're always thinking about what's happening at the neck, what muscles are in that area, and then how do we affect them in the shortest amount of time possible. Now, looking at the front of the shoulder blade is another thing that we have to be very detailed on. We have this muscle right here that's connected to the shoulder blade in the front, and it pulls us into an anterior tilt. So it allows me to put my arm behind my back. It's called the pec minor. So I reach behind my back because my shoulder blade does this little anterior tilt, and that creates space for this glenohumeral joint. If my shoulder blade's glued down, then I'm stuck in that position. I can't get it as far as I want it to. That's put stress on this joint. And if I'm sitting at computers for long periods of time, I'm gonna get tight in this pec minor muscle. So we've got to loosen that up. So we're always looking at the shoulder and the shoulder blade three-dimensionally. How do I loosen up the front? Right here, attaching to the rib cage, I've got to loosen up that muscle so the shoulder blade can sit down on the rib cage, and then the shoulder blade needs to be able to glide around, so we've got to loosen up that tissue. And then the rotator cuff muscles in the lat coming out to the outside right here, we've got to loosen that up so we have all this mobility right here, and then we have to fire our lower trap, our mid trap, and that serratus anterior muscle, and we have to maintain a chin tuck while we're doing it. We maintain this position, we do our exercises in this position with a chin tuck because of co-contraction. The way that we get stability is co-contraction, activating our deep neck flexors and our scapular retractors right here, and then our abdomen, and then our glutes. If we're doing that, then our body's doing a counterbalance against gravity, and we do that consistently. We take a lot of stress off the body, and we're able to keep ourselves in good positive positions where we have good space and we have good mobility and stability. If you found this video helpful, subscribe to the channel. We're going to keep putting out great content. Get mobile and stay active.